So good morning, everyone, or good afternoon, or good evening, or good whenever you're listening to this episode. Welcome to the MSA podcast. My name is Salha, and I'll be your host for this evening. So before we jump into this episode, I just want to say welcome back, everyone, to the second episode of the year 2021 to 2022. And I just pray this year brings with it immense success for each and every one of you, and thank you for tuning in to listen to us today. So today's episode is going to be a very light-hearted and fun episode, inshallah. Our guest this evening is Dr. Mohammed Alazmeh, who has very graciously taken the time to join us today out of his busy schedule. So we're very honored. Let me tell you a little bit about Dr. Mohammed. So Dr. Mohammed is an internal medicine resident, currently in PGY3 at King Faisal Specialist Hospital. And he was a member of Faisal's 6th batch, so he graduated in 2018, and so he's here with us today, so welcome, Dr. Mohammed.
Thank you so much, Salha, for this introduction. It brings me great pleasure to be here with you. I'm really thankful for the invitation. It's always good to go back home to Al Faisal. As I always say, Al Faisal is always my second home and will be my second home forever.
It's great to have you, and thank you so much for joining us. I understand you're very busy, and this must be one of the very few times that we can actually have you here. So thank you so much for coming.
Yeah, it's my pleasure to be here.
And I know what everyone is probably thinking right now. Oh, this episode is going to be another one of those episodes where they talk about how to apply for residency and how to match and how to do your CV and stuff. This is not going to be an episode like that.
Definitely.
Inshallah, this episode is going to be super fun and super light, and we really just want to highlight like the best and worst parts of residency, and just we want to hear it from a resident who's in their 3rd year now, and mashallah, like you just have this year and one more year left, right? Inshallah. So yeah, that's really what this episode is going to be about. So Dr. Mohammed, why don't you tell us a little bit about yourself?
So the first thing to start with, please call me Mohammed without doctor. Yes,
Okay.
That's I always tell like the students, interns, even like my juniors, please just don't make it formal.
Okay.
Take out the formality. Just go ahead. Mohammed is more than enough for me.
Okay.
Yeah.
And I understand that you've also been part of MSA before you graduated. So what would you do in MSA? What were you doing?
So I was member like of many committees, public relations, student affairs. Like we used to work on many events together. Like no matter what department I was belong on, it was like always a group work.
Oh, okay.
So, yeah.
Do you miss that?
Yes, a lot.
Yeah.
Yeah, especially like when COVID comes, there was no activities either like here or in the hospital.
That is true.
So it was just boring for me. Yeah.
So now that you've completed full 2 years of residency, you're in your 3rd year. What do you think is the biggest difference between being a student versus being a resident?
Residency is much more responsibility. Like there are patients directly assigned under your name. So no matter what happens to the patient, it's your responsibility at the end. Although you have a supervisor, like senior, fellow, or consultant, but internally you feel like you own this patient. This patient, he has a family, he is sick, he is in the hospital, he has kids, he has job to do. So you always do your best to get out safe and like with better health situation. So
you feel directly accountable for a patient?
Yeah, you feel like you have to be connected to your patients. Yeah,
it's kind of scary sometimes.
Yeah, it is. It is, yeah.
Do you remember your first ever patient?
Yeah, I do.
You do? So
yeah,
tell us about your first ever patient.
It was a patient like in the 60s. He presented with the stroke out of the window. He has like left-sided weakness, and he did well. He presented like 48 hours of his like initial symptoms.
Oh, okay.
Yeah.
And did he like have a full recovery and everything?
No, he had partial, but like by time they improve, they do well.
Oh, okay, alhamdulillah. And how was it like your first ever patient? What year of residency was this?
It was in October 2019.
2019.
That's when we started our residency.
And what was it like?
It was general medicine service.
Oh, okay. So you are doing your internal medicine residency. What was the one thing that made you choose IM? over everything else?
Actually, when I started my clinical years back in year 4, it was the first rotation that I began with. It was internal medicine.
Okay.
I immediately fell in love with it. Trust
Really?
me. Yeah.
Over everything else?
Over everything, yeah.
Oh, okay. I haven't done internal medicine myself yet. I'm in 4th year currently. I just did pediatrics. But I'm looking forward to it. A lot of people say it's really interesting.
Yeah,
It's really nice. So let's see, inshallah. And did you ever have any other specialties in mind? Like before you did your clinical years?
Mainly it was more towards cardiology, which is part of internal medicine. So you have to start with medicine, then you proceed with cardiology.
I actually want to do cardiology too. I have a few options. One is neurology, but one is cardiology. It's been one of my top 3. So are you considering are you going to consider cardiology in the future?
Yeah, definitely.
Oh, okay, inshallah.
I was born to be a cardiologist.
You think so?
Yeah.
Oh, inshallah, may Allah grant you success. Okay, so you told us about your first patient. What about a patient that you would never forget? Like something that really stuck with you, that really, stayed in your heart. Tell us about that.
So during my first year of residency, I was covering cardiology service. I was on call during like weekend on call, either like Friday or Saturday. They called me a patient who has a pain in his left foot. So I give him like paracetamol over the phone. The pain did not improve. I give him like IV, stronger medication, didn't improve. And then I decided to go and see the patient myself, why he's not improving. It's like something very short, happened like for a short period of time. So the patient, he had advanced heart failure, he had like severe symptoms, he had lower limb edema, he was not compliant to his medications, he was refusing our treatment. So like I saw him like 2 hours before this episode, he was fine. He was like, as usual, I entered to the room with the assistant consultant. He refused our treatment. He was staying like for nothing. And I give him like pain medication. I came to assess him. I think that he was obese and he has like lower limb edema, which is accumulation of fluid. But like I was trying to feel the pulse in his foot. The right side I was able to feel, but the left side I was not able to feel.
Oh no.
But like I was not sure, like is it because of his situation or because of my, because like we don't do this more often. It's because of my clinical skills of his situation, so I was not sure. So I sent like for some laboratory investigations.
Scans? Any scans?
No scans. The only labs test. I sent for lactic acid, which gives an idea about the tissue perfusion, and came back striking very, very high. Yes, very, very high. This was indicating like he has some sort of lower limb ischemia. So I immediately called the vascular surgeon, who it happened that the one who I called was a fellow he worked with during my internship. So like we knew each other. I told her this is the situation. I was unable to feel the pulse. The lactic acid is very high, and she told me, okay, I'm coming to you. And when she came to me and assessed the patient together, she told me, okay, listen, like I worked with you, I know who you are, so I took your complaint very seriously. I felt happy about this. Yes, he had severe lower limb ischemia. Unfortunately, he was not a candidate for any surgeries, and he died like 3 or 4 days
He died
that.
3 or 4 days later? Oh, Allah yarhamah. And did you manage to find out like why he had lower limb ischemia?
Because of like her poor situation.
Oh, just generally overall.
Yes, atherosclerosis, aging. Yes, he was diabetic. Yeah.
And this case stuck with you because you just felt overwhelmed that this the person that you called trusted you so much, and this man as well.
Yeah, exactly. Yeah.
I understand. It must have been you must have felt like such a responsibility.
Yeah.
Feeling like, oh, this person was relying on you.
Yes, exactly.
They were the one person. You were the one person they called when they had this.
And I think that like
pain.
2 hours prior to this event, he was doing well, like matching his baseline, and then he deteriorated further and further.
So in just 2 hours, his lactic acid spiked.
Yeah. No, not the spike, but the whole series happened. Yeah. Yeah. It started like.
Just he went downhill.
Must have started like a while ago. But like something was cooking gradually, and he deteriorated. Yeah.
Allah yarhamah. And so that was kind of sad. I also have another question. How would you recover from something like this? Like something happened, a patient very close to you, or a patient that you really valued. If they don't end up doing well, how does it feel? How do you feel?
It feels sad, trust me. It feels sad, yeah.
Does it stay with you for a long time?
Yeah, it's like for 2 days, then it goes away. That's the sad part of medicine. Like, because sometimes they call us when a patient pass away, they called us to confirm the death.
Oh,
So yeah,
they ask you to confirm the
yeah.
death?
So there is a protocol.
Right,
Like you
right.
have to examine the patient,
Mhm.
like check the pulse for 2 minutes, listen to the respiratory sounds, the heart sounds for 2 minutes. Then you order ECG. It has to be like flat line, and if the family like in the bedside, you convey the bad news. Sometimes they are aware the patient is dying.
Oh, okay.
They already know.
Mhm.
Sometimes they are not around. You have to call them. You have to break bad news like in a way to make like as easy as possible to them.
Right, right.
Because they are coming to the hospital. You don't want something to happen during the way or something.
Right.
Yeah.
So you have to be very gentle in the way you break bad news.
The way that I do it when someone is not around, I tell him that your dad or whatever is sick, he's deteriorating. Please come. Something might happen very shortly, so please come as fast as you can. That's the way that I do it myself.
So you don't tell them
No, not
until
someone,
they come.
Unless if they are expecting something, or they are familiar.
Right.
They are familiar with the general situation. Okay, yeah.
And I'm guessing you must also have to kind of judge their general state of mind, like whether or not the
it's like a male or female, the way they are talking to me like this.
Oh,
yeah.
okay. It must take a lot of skill to learn how to do that.
Yeah.
I could never imagine
It's
myself
hard.
doing
It's very
that.
hard. Yeah.
Yeah. Okay, let's switch to something a little bit less
something
heavy.
funnier, yeah.
Okay, so what was the most fun thing about your residency so far?
The fun things about residency, maybe like taking history when the patient is sick. He doesn't give you like some sort of good information. You try to make like to make like some sort of fun, some sort of jokes. We try like to lift them up. Okay,
Right,
you
right.
are fine. You are okay. Yeah.
When I was taking history, we had this one mother, because I just did pediatrics, so I would take history from the mother, and sometimes the mother would say something and the child would say something else, or like the child was, a lot of the time the child would be like conscious and awake and alert and everything. So sometimes the mother would be like, "Oh, my child has had a fever for the past 3 days," and the girl would be like, "I don't have a fever. I don't know what you're telling me about."
This happens with the elderly. Like sometimes,
Elderly?
the elderly,
Really?
like 60 or 70s, they don't like hospital. Okay, so no matter what I asked them, they said no. Did you have this? No. And no.
Like they want to leave.
Yeah, exactly. They want to leave, and they're like, the daughter or their sons or whoever is with them, they said no, it's not here, not telling the truth. No. So you don't know who to believe.
So who do you trust exactly?
Yeah.
Who do you trust?
I trust usually the
caregiver.
Yeah, the caregiver. Yeah.
Oh, okay. Yeah, for us as well, I would, naturally I would trust the caregiver, but the child would be so funny sometimes. And one time we had to examine this kid, and he wouldn't sit down. He kept jumping, and then he was like, I want to do it, and he would try to use his stethoscope on himself. It's a challenge, but it's a fun.
Yeah,
I don't know if you come across cases like that now.
Yes, because in King Faisal, we have like 15 years is the cut-off age between pediatric and adult. So sometimes, yes, we do like see patients who are like 15 years old.
Oh,
and
okay.
sometimes,
I didn't know that.
They act like children, basically, yeah.
That must be interesting though. So generally, what are the ages of people that you see? Like in general, like usually?
Yeah, 15 and above.
Oh,
yeah,
okay. So
like I remember the elderliest patient I saw, he was 97-year-old.
Oh wow. Oh,
Mashallah,
okay,
yeah.
mashallah, 97.
He was functioning very good. He was a very good 97-year-old. Yeah.
Okay, mashallah.
Yeah.
All right. So how does it feel to be in your third year now? After this, you just have 1 year left, right? So how does it feel? What's it like?
So it has like pros and cons. The good thing that the nurses, they don't call me about silly stuff like renewal medications, lab tests, uncontrolled blood sugar, the serious stuff that the usually the juniors deal with it. Electrolytes imbalance, the simple things. I don't get bothered by them.
Okay.
But like on the other hand, when I receive a call, someone calls me, I know that there is something happened. Which is like feels more responsibility. Because like during my own calls, we as internal medicine resident, we don't cover only for our departments. We cover about the others. We receive like consultations from the other services. We cover the rapid response team when there's like a sick patient, something happens like for short time.
Is it like a code blue?
Yes, a code, or like RRT is something like the step that below the code.
Okay.
Patient, for example, like the heart rate is beyond 130. Expect something. So the rapid response is activated, means that you want to catch the patient because further deterioration happens.
Right.
Yes. And we cover for this. For all specialties like surgeries, transplant, oncology patient. Cover for this is very huge responsibility.
You're the only person covering?
I am the first responder usually, as a senior medical resident, but I have a SU as backup. But usually we come first to assess the patients. We assess, we take like focused history, we do focused exam, we send for workup, and then we call the ICU for this. So it depends on the situation. If the patient is like relatively stable, okay, we take our time. But like if the patient is really sick, he is deteriorating, no, we deal with the short things. Like for example, is the blood pressure is low, we try to elevate it, and then we involve like ICU immediately.
So you said this was your first time ever being a leader for code. So how do you become a leader? How does one become the leader?
So the leader usually who is the most qualified person to lead the code. So like in all hospitals, usually the senior medical residents who are usually the team leaders, ICU, anesthesia, if they arrived early, they can take the leads. So it matters who is the most experienced one. So at that time, I was the only physician. The rest, they were like respiratory therapists and nurses. And I was certified to have ACLS. So I was the team leader because I was the most qualified person during that scene. And when the senior resident came at that time, he took over because he was more experienced than me.
Okay. So that's how it works. And do you just self-assign yourself? Like, do you see people around you and you're like, okay, I'm going to be team leader now. You do this, you do this.
Because like during the on-call times, we have a code pager specifically for code. When the pager rings, they said, okay, there's a code in this ward in this specific room. So when I arrived there, I introduced myself. Okay, this is Dr. Mohammed. I am the senior medical resident. I am going to be the team leader. And then I take over.
Oh, okay. It's very interesting. One day, inshallah, maybe we will all. I mean, I hope not.
You will never know. You will never know. Yeah.
But I hope one day we're able to gain enough experience to be a leader, inshallah. So, how is it like just managing like your personal life with all of this, like residency and stuff, and like hanging out with your friends and all of that? Do you ever miss any of that? Do you get a chance to just hang out with them as much as you used to?
No, it's all about time management. Like in university and residency, like later on maybe like I become a consultant, I will have like my own family. It depends on how you manage your time. Like for example, I have from 7:30 to 5 my working hours if I don't have on calls. After that, like I go back home, I eat.
7:30 to 5 is a long time.
Yeah, I don't know if I don't have on calls. Sometimes, this lasts longer if I have on calls. Yeah.
Oh my god.
So it depends on you how to manage your times. I'm not going to study for the entire week. I'm not going to play like for the entire week.
Right.
So yeah, if when I go back home, like I eat, I take a break for like 30 to 1 hour. Then I do something. For myself, every day, like I dictate sometimes to study for like 2 hours. Not every day, but yani.
Oh, okay, mashallah. Like you've managed to
but like for
schedule.
like 2 hours, read about my patients, read about specific disease. I work on research.
Oh, Okay.
But
Nice.
like on sometimes, okay, sometimes no, I decide no, I'm not going to study today. I'm going, for example, I'm going to run. For example, yeah.
Okay.
So
Right.
I'm going to take a tour with my bike. For
Oh,
example,
that's
yeah, I'm
nice.
going to the cinema. So it's not necessarily, yeah. I have my
Mm-hmm.
weekends if I don't have on calls. Thursday is my free day, is my off day. I don't study usually.
You know what? Me too.
Hmm.
Me too.
Yes.
Thursday,
No, no. I
100%.
believe you have to specify one day for yourself, no matter what.
That's exactly how I
Unless
do
if
it
you
as
have like a
well.
final exam or something, okay, this
Yeah.
is an exception. But otherwise, you have to assign a full day for yourself.
That's exactly
Hmm.
the way I do it as well. Because I'm like, Friday and Saturday are my full off days, so I
Hmm.
can spend those entire days studying. And this whole week I've been so busy and like doing so many things. Thursday I need to just not do
Yeah,
anything.
because you have to reward yourself at the end. Like take Thursday off.
Yeah.
For example, Friday, if you wake up early at
Mhm.
9 or 10 a.m.,
Mhm.
so you can study for like 2 or 3 hours. You can have like lunch outside with your family.
Mhm.
You can go back, so you can do like different things within the same day.
Mhm.
So it's not just like black or white. Okay, you have to be flexible sometimes.
Right.
Yeah.
So tell us about your very first ER shift. Do you remember it clearly? And just tell us a little about that.
Yes, I remember it like as if it was yesterday.
Oh my god.
There's some memories that will last forever with you.
Mhm.
I remember my first ER shift. The senior resident was very, very, very supportive. Someone who I worked with during my internship.
Mhm.
So we made the deal. He told me about my responsibilities, what the things that I'm expected to do, and the
Mhm.
things that he will take care of. So it was light shift. Alhamdulillah, we had like 3 4 consults during that time.
Mhm.
The way that we did it, he used to send me to see the patient first, take like full history and do exam, and then I go back to him. We discuss, and then we would go together to the patient,
Mhm.
which I liked the most.
Mhm.
Because sometimes when I take history, I forget to ask some questions. So he
Mhm.
would correct me. He told me, "Did you ask about that? Why
Mhm.
did we? Why you think this is important?
Mhm.
Why are we asking about this?
Right. Right.
How it's going to make a difference for us?" Yeah, it was very beneficial to me, and this is the way that what I'm doing now to my junior. So if we are not short in time, we have plenty of time to discuss and do things. That's what I do. I send my junior first, then I will join.
Oh, okay. Isn't it a bit like sensitive though, given that it's an ER? The patient might be in like very critical
No,
situation.
because no, we review the chart first together. We evaluate. We review like the vital signs. The patient complaint, the patient like
Mhm.
measure comorbidities,
Mhm.
and based on this,
Mhm.
we decide, and then
Oh,
we
okay. So
take over. Yeah.
if he's in very critical condition, you're not going to send
No,
a.
no, of course,
Oh,
definitely,
okay.
yeah,
Oh, okay.
definitely, yeah. So it depends on the situation of the patient first, because like patient safety comes first,
Mhm.
regardless. Okay, we are in training program. I
Right.
agree with that,
Exactly.
but like patient
Right.
safety, this what matters to us at the end.
And how would you say the ER feels different from like inpatient or outpatient?
Because in the ER, the patient like they are fresh, they are just presents to you.
Uh-huh.
So you have to figure it out what's going on with them.
Mhm.
So that's why it's important to take very detailed history, because whoever is going after you, he is going to read your notes.
Right. Right. Right.
Yes, and
Right.
sometimes they make judgment based on this. So you have to take very detailed history, because sometimes the patient they are confused. Their level of consciousness is not that good. Sometimes they don't have a caregiver with them. They are
Mhm.
elderly. So you
Mhm.
face like different situations.
Mhm.
Not typical scenario when a patient like healthy who has have like just fever,
Mhm.
he is walkie-talkie comes to you. But it's not this. This is not the
Mhm.
always because sometimes it's very challenging. Sometimes even the examination. Sometimes it's very challenging to the examination. Sometimes the patient is not allowing you. The patient is
And you're
like
entirely on your own.
yeah, sometimes yeah.
Oh my god.
Especially now, if no, I am a senior, so because in medicine you have to call the second in call, whoever like a fellow or assistant consultant,
Mhm.
someone who is in his home might be sleeping, so you have to you have to take their opinion, you have to take the plan from them. So so this depends on your judgment, on my
Right,
judgment.
right,
Like
right.
yeah, so what I do, like I take like full history, do full physical exam, I review the charts, the medications, everything. Then I have to call the second on call who is at home, who might someone be sleeping. Sometimes I call like at 3 or 4 a.m. And sometimes someone who is really sleeping, like بسابع نومي. You see someone is in deep sleep. Sometimes you struggle because you have to take the full. Okay, I can initiate my plan, I can initiate my workup, but sometimes you have to
Get a second opinion.
take second opinion, and the rest of the plans from the expert or someone who is more senior than you.
Do they ever
Yeah.
mind? Do they ever get mad at you for calling them at like 3 a.m., 4 a.m.?
No, they don't mind because they are on call, they are expected to call.
So they, okay.
But like sometimes they don't answer. It happened with me. They don't answer. You call once, you call after like 15-20 minutes, there's still no answer. Okay, what I'm going to do? If the patient is stable and I can initiate my plan on my own, okay, it's fine, I can delay things. Sometimes like a patient comes at 4, if the patient is stable, I'm confident with my plan, I can like wait till 6 to call the second on call. Okay, but sometimes I do it even like I don't just call immediately, I just wait sometimes. Okay, there is nothing urgent, I have this plan in my mind, I initiate, I call this guy who is at home sleeping. Okay, I did this and that, do you want to add anything else? So most of the time they agree with me. Sometimes they have something to add, and that's it.
And what happens if it's an urgent situation and he doesn't answer the phone?
For me, if I call the consultant immediately. Okay, give like 15 minutes window. Yeah, after that, if it's not answering, I call the consultant. It happened with me, yeah.
But like, it's a very fast-paced job. You have to like make sure you call immediately,
Yes,
make sure
exactly,
they answer, make sure you get the stuff done, and start the management. Oh my god.
Because I think it's your responsibility. It's your responsibility. You are the one who saw the patients. So the whole thing depends on your judgment, your clinical assessment.
Right. And how do you manage your like stress level? Because this all sounds super stressful to me. So how do you manage your stress?
Believe me, when you for myself, I work much better and hard when I am like under stress. I function much better during stress. You don't know, like God gives you this energy. Like when a patient really sick and deteriorating, I think very fast. I take like for me, like when I am in a code, when I am like in a code, for example, and patient is coded, like for example, in a case of cardiopulmonary arrest, the patient is dead. Actually, the patient is dead.
Medically, yeah. I guess,
Yes, is actually dead. No, not medically. It's actually
like,
dead.
Because,
So my job, like, bad Allah, is just to bring it to bring the patient back to life.
Oh my god.
So yes, so under stress, subhanallah, this I guess from God, this give you the strength to think fast, to make like fast decision. Yes,
that's probably one of the most important things about being a doctor. You need to be able to think super quickly.
Yeah. You have to handle
patient's
your stress.
Life is on the line.
Yes, you have to handle your stress because sometimes it's you only the barrier between death and the patient. But Allah, just you are in the middle. Okay, so what you are going, it will matter at the end. Yeah.
All right. And if I were to ask you, like, what is some advice that you might have for your fellow colleagues, or just anyone who's listening? Because a lot of people will be listening to this, inshallah, like first years, second years, third years, anyone. If you had advice in general to give them, what would you say?
Okay, I totally understand that medical school is tough, but like I did it, you are going to do it, inshallah. I made this before all of you. So inshallah, you will gonna over this by time. So don't worry, okay? So if you are like just started your first year or second year or like your clinical years, this period of time will become a memory one day, inshallah. What I want you to focus just to work on yourself. This starts from your day one and university, and I really mean it in your one. Because medical school is not just about like attending classes, taking exams, and just take a certificate after like 5 or 6 years. It's totally beyond that. First of all, I want you to work on yourself, to build your CV, gain as experiences as much as you can, learn things, get to know more people, build friendships, because at the end, this what matters to you. It's not just the certificate. The certificate is just a paper. It's the things that what you are going to do within these 5 or 6 years. That's what will matter to your future. So I want you to focus, especially like when you start your 4th year, to have a plan. What are you going to do with your future in terms of like specialty, residency places? If you are like considering US, UK, Germany, whatever, you have to have some sort of plans so you don't get lost. I want you to study as much as you can, to have fun as much as you can.
That's like 2 ends of a spectrum.
I know, but like you have to make a balance. Like yes, as I just said, if you have a hobby, don't leave it. Okay, try to work on it. Try to grow it, grow with it. Try to make yourself better. For example, if you like playing football, playing like once a week, this will not harm your future. Trust me, just 2 or 3 hours. If you go to the gym, you can go like 2 or 3 times per week. It's not, you don't have to go like every day for like 3 or 4 hours. It's just about a balance.
Right.
Go outside, have dinner. Like,
so you're really encouraging us to have a balanced life.
Yes, have a balanced
study
life.
At the same time, do
because
everything else.
You do like study during all the times, you don't have like social life, you're stuck at the end.
So how important is your social life to you?
Yeah, it's very very crucial to have some sort of social life. You don't mean like to go every day,
right?
No, just if you go like twice per week, you do something like for a short period of time, like on daily basis. If you go like run for 30 minutes, if you go just walk for 30 minutes per day, this will not harm you. And the other way around, like this will give you like, this will refresh your memory. This will give you like more energy. This will help you in like fulfilling your other duties.
Oh, right.
For like, if you take like short break, when you resume your work, okay, you will not, okay, you will still have to do more.
You feel rejuvenated.
Yes, you will have like the capacity to do more.
Okay.
Yeah.
Okay. So what was one thing that you've learned so far? The most important thing that you've learned?
I have learned to always work on myself, to be a better version of myself, and this is continuous. This does not happen like by one day or another. It's like more of lifestyle, continuity.
Everyone that's listening to this is going to take your advice and really genuinely apply it, especially what you said about the balanced life, and then again now working on yourself.
Because now if you go back to check about like our colleagues who are now mashallah like in the US or in the UK, like they are doing excellent, they are chiefs. The secret that they work on themselves earlier than the others. I think this is the secret.
Oh, really?
And they have some sort of like consistency. Okay, they have a plan, they stick to it, and it worked at the end. And this will pay off at the end, inshallah.
Well, I hope so, inshallah. I'm going to try my best to incorporate that advice into my daily routine. And I hope everyone else listening as well is able to, really apply that to themselves. Dr. Mohammed, it was a pleasure having you here. Thank you so much for joining us.
Thank you so much for the invitation.
Thank you so much for sharing everything with us.
I'm really glad to be here with you. I always as I always say, this is my second home. I always will belong to Al Faisal. Al Faisal, what made me the way that I am right now. It's the place where I shaped my personality and what I learned, the skills that I gained, everything. Yeah, but Allah, it belongs to Al Faisal.
I'm really, really glad. Like, all of us, we really want to be something like you, mashallah. Like,
inshallah, even you will be better, inshallah.
Inshallah. So like it's just something, like it's a dream, mashallah. What you're doing is something that all of us would want to accomplish, especially myself, considering that I want to do cardiology, inshallah, or that's one of my top options. So but yeah, thank you so much for sharing all your stories with us, and especially your life lessons. I think it was really important for us to hear that.
My vision. I'm always be here for you, inshallah.
And thank you so much to everyone who's tuned in to listen to us this evening. I hope you guys really enjoyed this episode, and I hope you guys learned something as well from Mohammed, not Dr. Mohammed. Yeah, that's all. Thank you so much, and we'll see you again, inshallah.